Good morning, all. Today we are going to see about the Unit 4 in Biomaterials and Artificial Organs, that is, tissue replacement techniques. The previous units, that is, in Unit 1 of Biomaterials and Artificial Organs, we learned about the structural classification of biomaterials, and in Unit 2, we learned the implant materials, that is, titanium, stainless steel, cobalt, chromium, like that. Then in Unit 3, we have learned about the polymeric implant materials, and now in Unit 4, we are going to learn about tissue replacement techniques. There are two types of tissue replacements. The first one, soft tissue replacement, and the last, hard tissue replacement. Soft tissue replacements. So, before going into the topic, first we see what are the soft tissue, what are soft tissues, and what are its examples. So, soft tissues are the tissues that connect, support, or surround other structures and organs of the body, not being the hard tissues such as bone. Because hard tissues comprises only of the teeth and the bone. Other than these two, that is bone and the teeth, other than these two, the structures and the organs that present inside our body are called as soft tissues. It includes tendons, ligaments, fascia, skin, fibrous tissues, fat, synovial membranes, then muscles, nerves, and vessels. We all know tendons means it's a tissue that produce connection between a muscle, and ligaments which produce a connection between bone and the muscle. The tissue replacement techniques comprises of sutures, surgical tapes and staples and adhesives. The first technique we are going to see about in soft tissue replacement is sutures. One of the most common soft tissue implants is suture. So these are used to close wounds due to injury or surgery. Then classification of sutures. There are two types of sutures according to their physical in vivo integrity with time. The first one, absorbable, that is being absorbed with the body. Also it is called as biodegradable and non-absorbable. Then the sutures are also distinguished according to their source of raw materials. So based on that, we are having two types: natural sutures, example catgut, silk and cotton. The second one, synthetic suture, examples nylon, polyethylene, polypropylene, stainless steel and tantalum. The third classification is based on their physical form. The sutures may be monofilament or multifilament. The first category under the suture is catgut. So it is a natural suture. The absorbable suture catgut is made of collagen derived from sheep intestinal submucosa. The name itself we can see, cat means it refers the cattles, that is the sheep, and gut means the stomach or the intestine part of that cattle. It is usually treated with the chromic salt to increase its strength and is cross-linked to retard resorption. Such treatment extends the life of catgut suture from 3 to 7 days or up to 20 to 40 days. The catgut sutures are stored with needles in a physiological solution to prevent drying and also to make the sutures very stiff and hard. In the picture itself, we can see the suture is placed along with the needle. Then second category under suture is synthetic sutures, which absorbs more slowly than catgut. Most synthetic sutures are made from PGA, that is polyglycolic acid, and is copolymer with PLLA, polyl lactic acid, to control absorption. There are some examples about this synthetic sutures given in the table. That is in multi-filament brides, Dexan, Vicryl, Polysorb and Panacryl. And in monofilament switches, we are having PDS2, Maxan, Monocryl, Biosyn and Caprosyn. The block structure and the polymer composition are given in the table. Then, so this is the graph that refers that weight loss is directly related to the strength change. That is in x-axis we are having time. So based on this, what is the change in the weight loss? It is given in the y-axis. Then, so this is also one of the graph that explains that different types of sutures and their absorption times. So different types of sutures are given in the x-axis as catgut, caprosyn, Vicryl, Biosyn, like that, and the absorption or the time is given in the y-axis. So based on that, we can see that the natural suture catgut is being easily absorbed. That is, within a short period of time, it can be absorbed by the body. Then, strength of the sutures. The stress concentration at a surgical knot decreases the suture strength of a catgut by half, no matter what kind of knotting technique is used. It is suggested that most effective knotting is the square knot with 3 ties to prevent loosening. So in the figure we can see the square knot that is having 3 ties which prevents the loosening. Then, how the tissues react with the suture. The next topic, that is sutures and tissue reactions. Catgut and other absorbable sutures, that is examples are copolymer of polyglycolic acid and lactic acid, which induce tissue reactions although the effect diminishes as they being absorbed. This is true of other natural, non-absorbable sutures like silk and cotton, which showed more reaction than sutures like polyester, nylon, polyacrylonitrile, etc. So we can see that both the synthetic and the natural sutures are producing the tissue reactions. Then, risk of infection. So what are the risk of infection we will have when we having some sutures? As in the case of the wound healing processes, the cellular response is most intensive one day after suturing and subsides in about a week. So we all know and we learned what is the process happen in the wound healing in the first unit itself. So in the process of wound healing, the cellular response is the most extensive one day after suturing and it subsides about a week. As for the risk of infection, the suture is contaminated even slightly, the incidence of infection may increases many-fold. The most significant factor in infection is the chemical structure, not the geometric configuration of the suture. So examples such as polypropylene, then nylon, PGA or sutures which develop lesser degrees of infection than sutures made of stainless steel, plain and chromic catgut and polyester. The ultimate cause of infection is the pathogenic microorganism and not the biomaterial. The role of suture in infection is to provide a conduit for increase of bacteria to chemically or physically modify the body's immune response or to provide an environment favorable to bacterial growth. So in this part, we can see that during the process of wound healing after placing the suture, the next day it will be more extensive. That is, the cellular response will be more extensive and after a week it gets subsided. And here we can see the most common significant factor of infection is the chemical structure, not the geometric configuration. So based on the chemical structure only, the risk of infection increases or decreases. Is given that polypropylene, nylon and PGA will develop lesser amount of infection when comparing to other sutures made of stainless steel, plain, chromic catgut and polyester. The main thing is not only by means of biomaterial, the infection happens by means of only the pathogenic microorganism. That is, we have to take care about the wound very carefully by being avoiding water, then contamination like that. The main risk of or the reason for the risk of infection is being through the pathogenic microorganism. Then the next part in tissue replacement techniques is surgical tapes and staples. Surgical tapes are intended to offer a means of closing surgical incisions while avoiding pressure necrosis, scar tissue formation, problems of stitch abscesses, and weakened tissues. So, the main risk of infection in sutures that leads to pressure necrosis. So necrosis means cell death that we have learned in pathology and microbiology of semester 4 itself, and it forms the scar, then abscesses of being having the suture like that. So all these things have has been avoided by the surgical tapes. But here also we are having some problems. That is, the problem with surgical tapes are similar to those experienced with band-aids. So what the problems we will face when we are keeping a band-aid over the injury is misalignment of wound edges. That's the first thing. Then poor adhesion due to moisture or dirty wounds. The late separation of tapes when hematoma, wound drainage, etc. Then, the wound strength and scar formation in the skin may depend on the type of incision made. If the subcutaneous muscles in the fatty tissue are cut and the overlying skin is closed with tape, the muscle retract. This in turn increases the scar area, resulting in poor cosmetic appearance when compared to a suture closure. However, due to high strength of scar tissue, the taped wound has higher wound strength than the sutured wound only if the muscle is not cut. So the wound strength and the scar information formation in the skin depend the type of incision. What about the cut or the depth of the incision made? It decides the scar area. But increasing of scar area will result in poor cosmetic appearance. So when comparing to suture closure is the best thing regarding the cosmetic appearance. Then tapes have been used successfully for assembling scrapes of donor skin for skin graft, connecting nerve tissues for neural generation, etc. And this is the figure which represents the surgical tapes. And the most commonly used techniques for soft tissue replacement nowadays are the staples. Staples are made of metals, example tantalum, stainless steel, and titanium nickel alloy, which can be used to facilitate closure of large surgical incision produced in procedures such as C-sections, intestinal surgery, and surgery for bone fractures. The tissue response to staples is the same as that of synthetic sutures, but they are not used in places where aesthetic outlook is most important. So commonly the main problem we are having in stitches is after the wound healing we have to remove the suture, so the patient may feel some discomfort or pain in that area, but by using the staples the pain will be less and it's easy to remove. It's made up of tantalum, stainless steel, titanium, nickel alloy. All those things we have learned in unit 2 itself. And the places where we can use the staples are C-sections, intestinal surgery, surgery for bone fractures, etc. A self-compression nickel titanium alloy uses the shape memory effect which retracts back to its authentic phase after insertion into the broken bone and is heat to body temperature as given in the figure like that. And the last one or the last technique used in tissue replacement is tissue adhesives. So this is the figure that represents the adhesives. The previous part we have seen that sutures, surgical tapes and staples are used to close the wounds. All these things will produce the scar and we are unable to use those in some areas where aesthetic look is more important. In such cases, we can use the adhesives. So tissue adhesives are liquid monomers that undergo an exothermic reaction upon exposure to a moist surface, changing into a polymer that forms a strong tissue bond. So these the same thing we can be experienced with the quick fix or Fevikwik like that. So if those things fall on our fingers, what happens? It releases the heat. Like that, tissue adhesives also undergo some exothermic reaction that produces a polymer which forms a strong tissue bond. The wound edges are approximated and 2 to 3 layers of tissue adhesive applied. Indications where we can use this tissue adhesives are when we need superficial laceration and the length of the cut should be less than 5 cm, then low wound tension, good wound approximation, and after placement of deep sutures to close the skin. Then properties of tissue adhesives. The special environment of tissues and their regenerative capacity make the development of an ideal tissue adhesive difficult. Past experience indicates that the ideal tissue adhesives should be able to be wet and bond to tissues. Second one, it should have adequate bond strength. And third one, it should be resorbable as the wound heals. The next one, not interfere with the normal healing process. It should offer ease of application during surgery. It should be sterilizable. It should have adequate shelf life and allow ease of large production. These are the tissue adhesive properties. Then, the main strength of tissue adhesion comes from the covalent bonding between the amine, carboxylic acid and hydroxyl groups of tissues and the functional groups of adhesives such as R, C, O, C, then amine group, then the nitrate group. Then, how these adhesives are being made or the main composition of adhesives are cyanoacrylate. So cyanoacrylate, acrylics we have learned in unit 3 under polymers. So cyanoacrylate Among the homologues of alkyl cyanoacrylate, the methyl and ethyl 2 cyanoacrylate are the most promising. The addition of some plasticizer and fillers, they are commercially known as Eastman 910, Crazy Blue, Super Blue, etc. The methyl cyanoacrylate has a similar chemical composition as methyl methacrylate as shown in the following figure. This is the composition for or the structure of methyl methacrylate or methyl cyanoacrylate. And so we have seen that adhesives have been made from acrylates and some adhesives has been derived from fibrinogen. Some have tried to use adhesives derived from fibrinogen, which is one of the clotting elements of blood, as we all know. The following figure shows the relation between fibrin concentration and adhesive shear strength. The x-axis we are having the fibrin and the y-axis adhesive shear strength. Then comparison between sutures and adhesives. An interesting comparison is given in the following figure that shows the bond strength of adhesive treated wounds is about half that of a sutured wound after 10 days. So this is the diagram which gives a comparison between the suture wound strength and the adhesive wound strength. The topical use of adhesives in plastic surgery and fractured teeth has been moderately successful. As with many adhesives, the end results of the bond depend upon many variables such as thickness, open porosity, flexibility of the adhesive film, and rate of degradation. So these are all about the soft tissue replacement. Thank you all.